A very good evening to you and welcome so much to the Oracle Television Network. Thank you for joining us and thank you for always being there and supporting us. And of course, when you see me on air, you know it's that time to be informative, it's that time to be educated, and it is that time for you to gain a knowledge. Mahali ambapo haukuwa unaweza. And today I am in love so much because we are going pink with a purpose. When I say pink with a purpose, I mean today we are tunashika kitu ambayo most of us take it for granted. Some people even don't think that they can get it or they have it, or rather we ignore that you can probably, you know, things happen, you might be in that process and you do not have that idea. And you know, we are in that month, we are in October, where this October, it is the month of breast cancer awareness. And that is why I saw that it is better for us to understand, because kuna mwenye hata ajui na si watu wakisema breast cancer, it is a breast cancer month awareness. Na apart from kusikia hivyo, inaishia hapo. Na kuna mwenye hata ajui mwezi na kuanga ya breast cancer awareness. And that is why I'm here for you, so don't worry. It is that time to try ile uchafu and we understand it better. And we are shining light on that topic because nilijua kuna watu wengi sana tunahitaji kupata ufahamu. Si kwamba ati these things, we know we are in this world, but we are not of this world. But that means that whatever happens in this world, physically, it might happen to, we do not pray that it happen to anybody, but if you find yourself in that situation, what will you do? Or if you have a family or a friend who is passing through that situation, what are you supposed to do? And what is it? How are you supposed to? Wow.
Thank you.
You see, you can find him in those places that he has mentioned, but pia huko mwisho atatuambia vizuri venye mtampata. But for now, you can keep on texting, you can keep on WhatsApping us, you can keep on pale kwa comment section, you can keep on commenting, asking those hard questions that umekuwa ukitaka kuuliza sana lakini haujapata platform. Now imejileta, please usilale na hiyo swali. We are here because of you. Our number is 0711 176 006 and we'll be glad to read it for you. Facebook page, we are coming to you live on the Oracle Television Network Facebook page. Be sure to comment pale, like, and of course share so that this information will get to as many people as possible. We are also coming to you live on our YouTube, that is the Oracle Television Network. Be kind enough to subscribe and of course click that notification bell. And of course, share, because you want as many people as possible to get informed and of course to get educated. Starting us off or kicking us off, what really is breast cancer? Because most people say this is a breast cancer month awareness, but if you ask them what is breast cancer, they just tell you a cancer of the breast and in a shiapo. What really is breast cancer?
All right, so first of all, what is cancer? Cancer is an abnormal proliferation of cells. And the other key thing about it is uncontrolled proliferation of cells. So for the breast, that will mean abnormal proliferation of cells of the breast that is also uncontrolled. Therefore, the cells grow out of proportion without a break. and therefore causing what we call breast cancer.
Breast cancer.
Yes.
So when you're saying it is the cells are growing beyond proportion, is there anything someone can do so that those cells will not grow out of proportion?
Yes, there is really a lot of things that you can do to minimize your risk. And there are also certain risk factors that are non-modifiable, things that you cannot do. Okay, for instance, being a lady or a female, these are not things that you choose. Once you are a female, it is one of a risk factor of getting breast cancer. If you are male, it means you are very low risk of getting breast cancer. Still, the risk is not zero, but it is there. So the kind of things that you can work on, I think, are one, physical activity. It has been noted that obese people have an increased risk of breast cancer. People who never gave birth, nulliparity. So we encourage ladies to get married and get children and to breastfeed. If you never breastfed, that's a risk factor. So it is important for everyone to get pregnant at some point in their lives as many times as they can, and to breastfeed their babies to the full 2 years that is recommended. It is protective. It has been noted that this is protective. Certain things also that one can do that have been noted that to be having an effect, for instance, is use of estrogen-based contraceptives. So what really has been noted to be one of the biggest factors in breast cancer causality is exposure to estrogen. So use of estrogen-containing contraceptives is a risk factor. And also some people take hormone replacement postmenopausal to prevent certain symptoms in menopause. So if it is estrogen-containing, still that is also a risk factor. So that one can be minimized. The other thing that is important that I must also mention is alcohol. Alcohol intake, especially excessive alcohol intake, is also been noted to be a risk factor because of the effect on weight and obesity and all that. And last but not least, smoking.
Smoking.
Yes, it's important not to smoke.
Oh, wow.
Yeah.
Hey, mi nimebaki pale pa ladies. Get married. Because inasaidia kuzuia. But are there different types of breast cancer or stages of breast cancer?
Yes, so there are different types and also there's different stages. The commonest is ductal carcinoma of the breast. Invasive ductal carcinoma is the commonest. I think more than 80% of all breast cancer that we see in Kenya are ductal carcinoma. And then the others follow, like lobular carcinoma and the other subtypes. As for staging, we have the standard stage for all for all cancers is stage 1, 2, 3, and 4, and it depends on the size and infiltration of the pectoralis muscle, and yes, mainly those, and metastasis, what we call when the cancer migrates from the breast and goes to another place. Then we say it's the highest stage.
Oh, wow.
Yes.
Let's talk about early detection. What are the signs or the symptoms or the warnings somebody should look after? Because hawezi jiambia tu let me go because this is it. Ama kuna wale watu wapendi kujiambia. There are those who actually genuinely go to get a body screening and they look how their health is. But kuna ule mwenye mpaka anangoja ifike ile point yenye hajiwezi kabisa ndo aende akue confirmed. What are the early stages that somebody should look for?
So there is something called self-breast exam that we encourage everyone to be doing at least once a month. If you're a lady and you have your breast, you need to be doing that once every month, at least once you are 20 years and above. Because for Kenya, it has been noted that our breast cancer incidence or the timing of it, it occurs in younger ladies compared to the rest of the world. So between 35 to 50 years, most of our breast cancer appears at that point, but the rest of the world, they are 50 plus. So you find for us, the younger generation need to be worried earlier. So the things that we want you to look out for is a lump. If you feel anything abnormal in your breast, you need to be worried. There is nipple discharge. That is anything coming out of the nipple that is not milk and you're not breastfeeding. Or maybe it is milk, whatever it is that is coming out at any time. The breast should be dry. When you squeeze the nipple, there should be nothing coming out. So if you see any discharge from the nipple, that should be alarming for you. Not all discharges are cancer, but it is good to come to the facility, see a doctor, and let them tell you that this one of yours is not breast cancer, and not assuming on your own. It can be red, it can be black. Yes, those are more alarming. And there are so many other colors that could come out. It could be milk, white, it could be yellow, but any nipple discharge should prompt someone to go to a health facility and have themselves checked out. The other thing is nipple changes, like the nipple compared to the other side, the contralateral side, should be approximately at the same level when you look at yourself in the mirror. So when you see one being lifted up, then you need to be worried. There could be something going on. And then there could be color changes on the skin of the breast, either darkening or just any color change should prompt you to be worried. And sometimes there is dimpling on the breast. That should also alarm you or anyone with such a change in their breast. And last but not least, there could be a mass in the armpit. Or yes, any mass should prompt you to be worried and come early for screening and for investigation.
Wow. And you said it is good for somebody to do a self-exam. Yes. You said somebody should press themselves. How much? Because you're telling me to press myself. The doctor said you should examine yourself. Let me examine myself.
So what we recommend is a quick exam through all quadrants. So the breast is divided into 4 quadrants.
Okay.
Upper, lower, there's upper, outer, upper, inner, and lower, outer, and lower, inner. So I wish I had a breast, but if maybe I could demonstrate.
Yes, please.
You press against your chest on the breast, and then you move sequentially all round, surrounding the nipple. And when you're done, you finish by pressing on the nipple.
So when I'm pressing my breast, what am I looking for?
You're looking for any abnormalities. Because if you do it routinely, you know how your breast should feel. So any change, any excessive firmness should make you to be alarmed. If you feel could be a lump or there is pain. Of course, cancer usually does not present in the early stages as pain. It's usually a painless lump. But pain also sometimes presents in breast cancer. So when you feel some pain, it should also be alarming. Of course, most of the time, pain is a good thing.
Pain?
Yes, when there is pain, it is unlikely to be cancer.
Okay.
So yes, so even when you come to the hospital, you should know that maybe it might not be cancer. If it's really painful, it could be a boil. It's the most painful thing anyone has ever experienced.
Yeah, true.
Yeah.
Okay. And are there myths that people have in beliefs that surrounds breast cancer, which is not true? What are some of those beliefs?
I think the population some of them really have very wild things. But one that I have heard about was that if you go to the hospital and a piece of it is cut, it will worsen. So, like for Kenya, most of the breast cancer that comes to the women with breast cancer that present to the hospital, they present in stage 3 or 4, actually 68% of them. So most of them have I can say, a low 5-year survival when it's stage 3 and 4. And early, we define it as stage 1 and 2. So for some communities, I think they have a notion, which is not right, that when they come to the hospital and a piece of it is taken for testing, because usually there is what we call biopsy. We have to take a piece of it, either using a fine needle or something that we call a biopsy, a cone needle biopsy gun. So there are certain communities, especially around the Rift Valley, that believe that such a test will worsen your prognosis and actually make you die from it. I think that is not right.
I think we tend to think when you're saying a piece of it, you're imagining the size.
We think it's like a big loaf of bread.
Piece, yeah.
It's usually very tiny. In fact, even looking at it, I don't even have something I could show, but it's like, the tip of a pen. Very tiny bits are taken up, and then they are examined by a pathologist in the microscope with certain special stains. And then they are the ones that help us to make that diagnosis that this one for you is not breast cancer, or this one is breast cancer. And then the other thing, people think that the diagnosis of cancer means death.
Yeah, true.
It is not true. The diagnosis is the beginning of a hope to cure. So once the diagnosis is made, in fact, it's even a good thing that the diagnosis is made, because if it is not made, then it will progress and it might cause death in somebody, an unknown death. And people will start asking what really killed this person. It is really better that the diagnosis is made, and the earlier it is made, the better. What else could I say? I think...
maybe if I ask, most people, is it always inherited from families, or it can start just from you? But most people think that if you have a breast cancer, likely your mother had, or if your mother passed, your grandmother might have it.
Okay, so there is familial, or what we call hereditary breast cancer, and is linked to what we call BRCA1 and BRCA2. These are tumor suppressor genes. They are genes that are responsible for looking for cells with DNA that have changed a bit and causing it to be repaired so that it does not propagate to the next generation and cause cancer. So for people who have been tested and they have that specific genetic mutation in the BRCA, they have that risk in the immediate family. That is a sister, a mother, a child, usually a first-degree relative. And apart from that, there is still a hereditary risk, even if you do not have that mutation, but it's very minimal. For those who do not have the mutation, the risk is very minimal. But for the BRCAs, the risk is a bit high. The lifetime risk is between 40 to 60%. It's quite high.
Okay.
Yes.
And there's this other myth. I don't think, let me call it a myth.
Yes.
People say if you use deodorant and if you wear tight bras, you're at risk of getting breast cancer. How true is that?
I think that is false. It's totally false. However tight your bra might be, ever, whether it makes your breasts to come at 90 degrees, or I don't know why some people put on tight bras.
Yeah.
It is not a risk of breast cancer, and it should not be listed as another myth. And the other thing you said was what?
if you use deodorant?
Okay, a lot of deodorants contain the chlorofluorocarbons. I doubt if they have been linked to breast cancer. The only thing that has been linked is the smoke, and smoke has so many things, but really deodorant, I think I've not seen any studies done on deodorants. Maybe it's a point we could study further and look at, but I doubt. There is no science behind it. It's just a thought.
Okay. Someone is saying, so men are actually free from getting this breast cancer.
Men are not free. Let me reassure them. Is it a lady asking?
No, it's a man. Yes.
Okay, let me reassure that man that men, despite having a low risk of breast cancer, when breast cancer happens in a man, it's usually aggressive and it progresses really quickly to the higher stages because the breast tissue in a man is really minimal. And when it grows, maybe let's say it grows to 2 centimeters. For a lady, 2 centimeters is very small. It's just a small part of the breast. But for a man, that could be the whole breast. So yes, and I think the total risk for a man in sub-Saharan Africa for breast cancer is 6%.
6%?
Yes. So it varies between 1 to 6. So I think they should not think that they are totally safe. Yes.
Okay, Anne is asking, can lifestyle changes really lower one's risk of developing breast cancer?
Yes. All these things that I mentioned have an effect on one's lifetime risk of getting breast cancer. So physical activity, alcohol avoidance, smoking avoidance, do not use tobacco in any of its forms, and having children and breastfeeding their children, they are actually protective. And then avoiding estrogen, based contraceptives, as opposed to progesterone. Progesterone is protective.
Okay.
Yes.
Okay, what is the right age to start screening?
There is a guideline actually for it, but as from the age of 25, somebody should start screening for breast cancer. And the self-breast exam is not considered a screening method by us as doctors. But for the general population, it's really useful, and it helps people to detect any abnormalities in their breast earlier, and then they can come to us for the screening method. Usually we used either the ultrasound or a mammogram based on age. For women less than 35 years, we use the ultrasound, and above 35 years, we prefer the mammogram. Mammogram is actually the best screening method of breast cancer.
You just mentioned mammogram, and somebody Lynette is asking, how effective are mammograms and other screening tools?
So I can say mammogram is a tried and tested breast screening tool. It has been shown that it helps to detect cancers early, and it has an overall effect on mortality in the whole wide world. So developed countries that have proper screening programs actually offer this free to everyone in the population as long as they are 35 years and above.
Okay.
I think for our setup, most of it is paid for either by insurance and the emerging. I think currently we talk more about SHA. Yes, so I think mammogram is very effective. So everyone who is eligible, every lady above the age of 35 should at least do a mammogram. Once every 3 years is fair enough.
So those who are below cannot?
Okay, below 35 years, there is the issue of breast density. The breast has more tissue, so the mammograms sensitivity is a bit less. So for this age group, we tend to use ultrasound because then it is better. It can actually characterize lesions better for that age group. But above 35, the breast becomes less dense. Yes, and then the mammogram comes in.
Okay, Cheru is asking, how can someone tell the difference between a normal lump and one that needs medical attention?
There is no normal lump.
Okay.
All the breasts should never have any lump. It should be just breast tissue. So if you have a lump, it's abnormal. Come to us. We need to do a screening test for it so that we know whether it's normal or not. And sometimes we need to do an FNA, fine needle aspirate from the lump, and all sometimes the cytology, the core needle biopsy. That is the gold standard. Taking a piece of tissue and looking at it from a pathologist point of view. That is the only way to know whether the lump is a benign lump or a malignant lump. But there's no normal lump.
So if you just have a lump, you are a candidate of
screening
screening
and testing, and then you can know that for sure this lump of mine is harmless.
Okay.
Yes.
Wale watu ambao walikuwa mnasema kuna normal lump, there's no normal lump.
Yeah.
So if you've been feeling type away, please just go to the doctor so that you can get clarified what exactly is happening to your breast. And it is very important because the ignorance that we carry, let me say we, because kuna vitu mingi zenye watu ignore. So being ignorant, it will make you to end up doing scale cheap is expensive. It appears even here. So you'll end up having maybe losing the entire life that you could have celebrated well. But now, just taking care of yourself, knowing how important your health is, it is the first gift, best ever gift you can give yourself. So make sure anytime you check yourself, anytime, every month, once per month, how many times? Once per month, check your breast. If everything is fine, everything is okay. If you feel something type away, go see a doctor. Let them explain to you. Don't diagnose yourself also. Unasikia niambiwa, Trevor aliniambia venye alifeel hivi, aliambiwa yake ilikuwa sawa. Hata mimi niko sawa. No, don't take experiences of others like your own. Just go and see and be told if there's a need to be worried or what are you supposed to be doing. Somebody is asking, does stress or emotional health have any connection to breast cancer risk?
Emotional health. I think there have not been any studies done on that, and really trying to do a study on emotion is really difficult.
Okay.
But I can safely say there is no obvious risk that is associated with stress and all emotion, unless it will affect one of these factors that we mentioned. If the stress causes you either to gain weight, to become obese, or to use alcohol, or to smoke, but stress on its own is unlikely to have any effect on breast cancer risk.
So watu wache kuwekelea stress.
Usiwekelee stress kama bosa amenikelelesha sasa niko na cancer, hapana.
Okay.
Yes.
And how can women actually live healthier so that they reduce their chances of getting breast cancer? Because unajua watu wengi umetuambia tu saizi how tight your bra is, haimaanishi utapata breast cancer. Yeah. So there are people who are living like that. How healthier can women live so that they can avoid getting breast cancer?
So yes, so number one, diet. You have to watch what you're eating. It has been shown that high-fat diet actually has an increased risk for breast cancer. So eat healthy, eat a variety of foods. That means you eat green leafy vegetables, eat some egg, eat some fish, eat some protein, some plant-based protein like beans and the legume family, and then take some carbs. Take them in the correct quantities. When you're saying taking carbs, we are cutting carbs completely because carbs are making us. So all these things, we need them at certain proportions. Okay. So we need to take some protein, some carbohydrates, some fruit. Most of our plate, actually half the plate should be fruit and vegetables. Okay. And then the other half you divide into two. Half of it should be proteins and the other half is carbohydrate. But the typical Kenyan will do the exact opposite. Half of it will be ugali, and the other half protein. We need to feel like stomach is satisfied or is swelling and full. So we really encourage people to eat more fruit, more green leafy vegetables, less of fat, and then exercise. So one thing that is really modifiable is our physical fitness. We should not be obese.
Yeah.
And the only way to do that is to exercise regularly. And what is recommended is 2 hours and 30 minutes a week. Or,
2 hours?
Yes, per week, or 30 minutes per day. And you take it consistently, so that by the end of the week, you have reached your 2 hours of aerobics. Brisk walking or jogging or whatever it is that you find it fun to do. You can play football, play netball. Ladies, what games do ladies like? I think they like netball, handball. Yes, whatever it is that works for you, you should do it 30 minutes a day. And then that will modify your risk really greatly. And then have a child and breastfeed them. Don't protect your beauty too much.
No need to glam up.
Yes, nowadays ladies tend to ask themselves, what will happen to my breast if I breastfeed? Just know that when you breastfeed, it protects you from cancer. Allow your baby to breastfeed your own milk and let them get the best of the best nourishment that God provided for them.
Is that 100 when you breastfeed, like you're now completely, you won't get breast cancer?
The answer is no. So these are risk factors. They are really not causal, and they will not essentially prevent 100% of the population from getting cancer, but they reduce the risk. So if you take 100 mothers who have breastfed and you take another 100 who never breastfed, cancer will occur more in the other 100 who never breastfed.
Okay.
Yes, but it's not zero for the ones who breastfeed. They have less, but it's not zero.
It's not zero?
Yes.
Okay.
Thank you.
So for somebody who is already diagnosed with breast cancer, and this person is watching us, what is the current maybe available treatment for this person? Because now she's already diagnosed with it, and life cannot end because you have it.
Okay, so one thing I appreciate about our country and my country as well is that we have some of the best treatment modalities that are available even internationally. So we have chemotherapy, we have radiation therapy, we have hormonal therapy, we have some targeted therapies available, and we do the proper testing for hormonal. If your cancer is maybe progesterone or estrogen positive, we have a drug that can actually cause the cancer to reduce in size. And I think, so we have some of the best treatment modalities in Kenya right now. And it's all available in our public facilities, in the private facilities, and most of it is also covered by national insurance. So no need to worry about treatment. Just come to the hospital. You will be surprised that most of what you need is available in the public facilities.
Wow. And this technology, can it bring recovery completely, or just...
For any cancer, survival depends on the elimination of the cancer tissue from the body. The main treatment is actually surgery. So these other modalities are supposed to eliminate whatever else might have remained as what we call micrometastasis. Very tiny, tiny, tiny tumor cells that might have remained or might have moved into your blood stream or moved to a distant site but has not been seen. Then the chemotherapy will come and act on it and eliminate it. The radiation therapy will act on it if it's in your armpit and eliminate it. And the hormonal therapy, which is usually taken if you are estrogen positive for 5 to 10 years, now will prevent a recurrence.
Okay.
So you'll end up having really good prognosis and good outcomes. And I encourage everyone who is living with cancer not to lose hope. Yes.
And somebody, let me paraphrase the question, is asking if you already had the cells of the cancer, can it move and become another type of cancer in your body?
He's asking, so what really are they asking? They're asking if you can have maybe cancer in your breast.
And also then it transfers, and again you have maybe that cell kind of quick cervical cancer.
No, I think, okay, there have been some cancer cells or cancer tissue, what we call teratomas, that have different types of tissue.
Okay.
You find it's a cancer maybe in the ovary, but when you open inside, it's not ovarian tissue inside it. That can be there, but really getting breast cancer, converting to cervical cancer, I can say it's difficult to say never in medicine, but this one I say never. Breast cancer cannot convert itself and become
something else.
Yes. What can happen is the cancer cells from the breast going to another organ and causing a growth of breast tissue, abnormal growth, what we call metastasis.
Oh, so it will cause a growth.
Yes, it can cause. It can actually go to the brain. The breast likes the brain and the bone. It can go to the bone and cause a new growth in the bone that is originally from the breast. And even when you examine it pathologically from the microscope, you see breast tissue. You don't see bone tissue. So it has not changed into bone.
Okay.
What has just happened is the cancer has spread. Yes.
And when somebody is diagnosed, how important is the family or the community around? Because most of the time we tend to like sideline them, because we say if you come close to them, watakuambukiza.
All right. So breast cancer is not infectious. That means when you live with somebody with breast cancer, they cannot give it to you. Like maybe the COVID, you used to avoid all our loved ones with the COVID.
Yes.
Yes, so you should actually be as close to them as possible, offer them support, emotional support, financial support. Cancer treatment is expensive. They need a lot of things. They sometimes need to travel long distances to maybe to Nakuru, to Nairobi, to get certain tests done, and then they come back. They really need the whole family and all the friends and all the church friends and all the normal playmates that they meet around. Everyone should come together and support this person, because otherwise then it is possible that mental health problems will kill them before the breast kills them.
Okay.
Yes.
And what can you advise somebody who's right now battling with that breast cancer?
What advice do I give them? I tell them that listen to your doctor. Whatever they are saying is really the truth. They're not lying. If they're saying come to the clinic on such a day, turn up on the clinic, take your correct medication, buy whatever it is that has been recommended for you to buy, and take it as prescribed. Exactly as prescribed. Do not delay treatment. Some people tend to present to the facility very early, but in between the diagnosis and the start of treatment, they go back home and they stay for a year. And when they come back, the cancer has spread and it has become so big. We encourage you not to disappear. When you present to the facility the first time, kindly be consistent, come again, and come as per the schedule, and try to follow up your treatment. Make it as the time from between diagnosis and treatment should be as short as possible to maximize survival.
Survival.
Yes.
So that means you'll have frequent visits to the hospital.
Yes, I would not say frequent, but I would say timely. What is recommended should be done within approximately by 1 month. Everything that needs to be done should have been done, and now you should be on treatment.
Okay, because now we see when somebody is battling with breast cancer, we see you said it is timely for them to. What can churches, communities, and society do to help these people who are battling with cancer, and also those who don't know about it, so that they'll not get to that point? You know, prevention is better. Prevention
is better than cure. So I'll speak for churches first, because the church has a huge role in improving the health of the whole population, because everyone trusts and believes what the church elder, church pastor has said. If they say that you need to go and have your breast examined, they will come.
Yes.
If they say that you should not go, that the breast is not cancer, come, I pray for it, they will trust.
And they will come.
So we encourage the churches to tell these cancer patients the truth, that they need medical treatment. Of course, they need the spiritual treatment as well. The pastor can come in to this member to pray for them and encourage them, but let them at no point stop their medical treatment. They should do it to the latter so that they maximize the chances of survival.
Okay.
There's a reason that God gave knowledge to all these men in the medical field. Which other group can I talk about? Maybe the community. The community needs to spread more awareness and to read more and to educate themselves more. We are living in an era where information is almost free. You just need data in your phone. You type it and you get it. And therefore, there really is no need for us to live in ignorance. We need to know about these cancers, know how to prevent them, do our best to prevent them, and then catch them as early as possible through these screening programs. Breast is, I can say, one of the good ones because it has a screening program. It's easier to detect it early and easier to treat, and therefore better prognosis if the patients present early.
Yes.
Yes.
Okay, someone is saying, where can people go for help or screening or counseling?
Okay, where can people go for screening? Any public facility offers screening at the primary level, level 3 and level 2. They offer all their services for free. At level 4, most of the services are paid for, but there could be insurance cover that covers that, including SHA. And level 5 hospitals, they are most comprehensive. They have all the tests that can ever be done about these things. So presenting to the level 5 facilities is really a good thing for a patient who has a lump and thinks it might be cancer. I advise them to present at the nearest facility. Do not shun the facility that you have, that now this one is too small, what might I get here? You might be surprised that is the place where they can do that finding the aspiration, they can do that pathology and send it and bring you the results really quickly and shorten your time to diagnosis.
I think most people, maybe if you'll speak, most people think that when you go to these small clinics, when you go to these dispensaries, we'll not get what we're supposed to be getting. Is that true? I mean, it's the myth that we've been drinking all around and assuming that we must go to a big facility so that we know that we are getting the right and the best.
I think it's not true. All the workers that are working in all these facilities, level 2 facilities, 3, 4, 5, and 6, are trained.
Yes.
They're actually trained in these level 6 facilities and level 5 facilities. So they know. When they tell you this one needs this test, they know it. It really needs the test. You need to get it done. They are actually offering the best that they can offer with limited resources. So and then the cost is also much lower at the lower facilities. So really the first place someone should present should be the lowest facility nearest to them. But we do encourage everyone to present at any facility of their choice. If you do not feel comfortable with going to that level 2 facility, come to that big facility, huge facility, expensive facility that you want and get tested. What we want is the time to diagnosis to be as short as possible, regardless of the point where you first presented.
Wow. So it doesn't matter if the facility is small or big. I think we need to change our mentality and know that I'm going to get treated. And this person that maybe you're assuming, or for lack of a better word, unadharau, when you go to that big facility, you might find the same person in that big facility. So let us change our personality, let us change our mentality. And when you go to hospital, let us tusikue, kuna ule mtu ambaye anaenda kwa daktari lakini yeye mwenyewe ni daktari already. You're getting my point. You've already diagnosed yourself and you already said, daktari, mimi najua hii lump iko hivi na hivi. Just go and say that I did a self-examine and I'm seeing like something is not good. And of course, let us be truthful. Nafika pale unasema unaulizwa maswali mingi. Hizo maswali mingi ndio ina lead to the correct diagnosis. Kuna ule ambao utajaribu kuficha maneno mengine usiseme zingine, kumbe unajiharibia mwenyewe. Let us be truthful, let us be open as possible so that you'll get the right and the correct. Utambue ile correct thing that is happening. Maybe the lump that you're having is not even cancerous. And of course, maybe kuna kitu ingine imeileta. So be truthful, open up and utasaidiwa kwa kiwango yenye daktari Mungu amemweza. Unajua tunajua zaidi ya yote daktari anakutibu, Mungu atakuponya. But before Mungu akuponye, ona daktari, because we know your health is so important. You might have so many wealth, but if you're not healthy, you'll not enjoy it. Haja gani utafute mali alafu mtu mwingine afurahie? Tulisema ni vizuri pia wengine wafurahie, but ile muhimu zaidi ni pia wewe ufurahie kazi ya mikono yako. That is the best part. Remember, we're always coming here every single day. We are on air because of you. So make sure you partner with Oracle TV so that we keep on being on air. Wale ambao umekuwa mtushikilia from day one until now, we totally appreciate, we love you, we acknowledge you, and we know that the good Lord will open the windows of heaven for you so that everywhere you go, trust Him, your favor will be part and parcel of your life. So to become a partner with Oracle TV, you can partner with us through our pay bill 171133, and account name is Oracle TV. Or also, there are so many ways of partnering. You can become you can bring your advert, and when you bring your advert, also partnering with Oracle TV. You can say, Mimi Staki advert, I want to be mentioned in every single show. That is another thing, another way of you partnering. You can say, Mimi nataka ile kipindi ikiwa pale, product zangu zinapita hapo chini. That is another way of also partnering. Ama unasema, mi penye mefikia, just want to go to that show. I want to shoot 25 minutes, I want 30 minutes so that I can speak, people to understand me properly, to understand my product properly. We have slot for that. And if you want to know more about partnering, you can also call the same number 0711 176 006, and we'll be glad to guide you through and show you. Na kama unasema mimi naweza taka advert but sina hiyo video, we have qualified videographers, we have qualified people who will guide you, advise us and tell you what is the best thing for you to do, how will you do it. If you do this way, unajua kuna ule umeona tu video ni kuchukua unaweka, hapana. They will tell you if you do this kind of video, will not bring you what you want. This is the quality you are supposed to be doing your video in. This is the script. If you want all that, if you want somebody to do your graphics, we already have that. So just call that number and we'll deliver for you. Daktari, naona masaa imeenda. Now, you know, time will always never be enough. As much as we try, time will not always be enough, but we'll make use of what we have. Can you give us your final parting shot?
Okay, so my final message: know your breast. Know your breast, and choose a healthy lifestyle, and at least do a mammogram, and you will be happy. And I wish you all the best. And for those who are sick, just know that the diagnosis is not the end of life. There is hope, there is treatment, and there is life after treatment. Thank you.
Wow. Imagine there is life. You having it does not mean now your life has ended. Please don't feel like the world has come to an end. Just do the right thing. Follow every single step of what the doctors are telling you, and trust me, God is a miracle worker. When you follow what you're being told, trust me, God will do His part, and you will come to testify what God has done. Thank you so much for joining me. Thank you so much for being together with me, and thank you for those who have commented, those who have shared. Trust you me, people will get knowledge. And also, kama umepata tukiwa tunamalizia, go back on our social media platforms, start from the beginning, and you'll get the knowledge that you require. I've been your host, Trevilla Luther. This has been the Health Tech, your medical line, of course, directly to the specialist. Until next time, same time, same place. God bless you.